Hi there, my name is Sonal Mehrotra Kapoor. You're listening to us on NDTV special campaign Banega Swasth India, where we continue to bring you quick tips on how to keep yourself healthy and safe. Today, we are going to talk about something hugely requested and talked about, which is COVID in kids. Now, more and more scientists are saying that once the third wave hits India, kids are going to be most impacted. Also, in the second wave, we've seen a huge escalation in the number of infection being found in younger adults and even kids, pregnant women and newborns as well. So it's very important to watch out for the symptoms. Also, something that has developed quite troublesome really is something called an invisible killer in kids, something called MISC. Now, why is it called an invisible killer? Because this is a disease in which your kids are going to test RT-PCR negative. They might even have good amount of antibodies, but still be undergoing MISC. So there is no test really in a way for it that can be done beforehand, but only symptoms that need to be watched out for. So over the next few minutes, I'm going to tell you what exactly is MISC and how to stay clear of it. Now, first, what does it stand for? It basically stands for Multi-system Inflammatory Syndrome in kids, MISC. Now, most children who've been impacted by COVID-19 will recover, but some of them end up developing some organ and tissues which get really inflamed, meaning the level of inflammation in the body is really high. It could be in parts of the body like your heart, your lungs, blood vessels, kidney, digestive system, brain, and skin as well. Now, this is most seen in kids in the age group of 3 to 12, though in US it was witnessed in some kids in 18 to 19 years of age as well. Now, before I go forward and you get really scared about it, remember that MISC is extremely rare. But now that our overall COVID number base is increasing, so the number of these cases are also increasing with it. Much remains to be learned about this inflammatory syndrome. So there are some symptoms that you need to be extremely careful about in kids. Now remember, this can happen even in kids who have not got COVID or have recovered from COVID. A lot of kids might have got asymptomatic, and so you would have felt that they never got COVID. So how is this post-COVID syndrome really coming in them? You can't say for sure. So you have to watch out for symptoms. What are they? Rash on the skin, vomiting, diarrhea, feeling unusually drowsy or not being able to stay up. A lot of kids sort of complain of that. Redness in the eyes, enlargement of your lymph nodes, faster heartbeat, rapid breathing, and redness or swelling in your lips, in your tongue, in your hands, and in your feet. A lot of times what happens is kids are not able to tell you what is wrong with them. So they end up just being very irritable, or they don't get up from their sleep. They're not very reactive and they just go really quiet. Those symptoms also parents need to be extremely watchful for. Like I said, in these cases, a lot of times parents think that, oh, we have antibodies in the body, in the house of everybody. Oh, they've tested negative of COVID-19, but you cannot drop your guard on this one. Because in this case, the sooner you let your pediatrician know that your kid is showing these symptoms, faster the treatment really will be. So what happens? First up, if you have all these symptoms that I have just told you about, call your pediatrician, let them know. They will end up doing mostly some of the inflammation markers, some blood tests, etc. They might ask you to get a chest X-ray done, your heart ultrasound might be required, your abdominal ultrasound as well will be required, and that will give the doctor a marker of how much amount of inflammation is really there in the body. In a lot of cases, kids are asked to get admitted immediately because these are markers which rapidly fluctuate or can go up overnight, so they don't want to take a risk. So let your doctor be the final call on any of these symptoms that I've talked about. They might also treat it by taking them on board with some oxygen support or treating it within their intensive care units as well. But that happens in extreme cases. Remember again, this is an extremely rare syndrome, but is increasing by the day. And the only thing that you should be doing at this point is watching out for all these symptoms in your kids. In fact, not just now, even if they've recovered from COVID for at least 3 months, these symptoms can crop up in. So you need to be very watchful during that duration, especially. I hope this was helpful. Don't panic, stay calm, and at the end of the day, let your pediatrician, let your doctor decide what's best for you and your family.